Well, what we do know about PIP implants is that the manufacturer did a dreadful thing. He used silicone gel that was different to the approved medical grade silicone gel in order to save money. And that's caused an enormous amount of distress and worry for patients all over the world. So it's been necessary to do the tests on the silicone in PIP implants after they've been put into people rather than before, as it should have been done. What the tests have shown is that it's not toxic. It means that there's no increased risk of cancer with it. It means that it doesn't affect your reproductive capacity, for example. And it means if the implant leaks, it doesn't cause any more inflammation than any other brand of implant leaking. But what we don't know yet is whether or not the risk of rupture of PIP implants is more or less or the same as other implants. But we're getting that information because so many patients are now having MRI scans. And in a few months, we'll be able to tell you what the rate of PIP rupture is compared with other implants. Most patients who have a ruptured silicone implant, whether it's PIP or anything else, actually don't know about it because it doesn't cause any symptoms. There are many examples of women who've had a ruptured silicone implant for many, many years, and they've only found out about it when they go and have a breast scan for some other reason. So you can't rely on how you feel or how the breast feels to know whether you've got a rupture. The only way to know for sure is to have an MRI scan. And that will tell you with about 90% certainty whether or not you've got a ruptured implant, whether it's PIP or whether it's any other kind of implant. And that's one of the reasons we recommend patients who've got PIP implants see your doctor, go and get an MRI scan, and that will tell you whether your PIP implant is ruptured or not. When an implant ruptures, the gel leaks out. The more minor kind of leaking is where the leak comes out and stays within the capsule or the membrane that grows around everybody's implants, and that's called an intracapsular leak. The more extensive leaking is where the gel gets out beyond the membrane and into the surrounding breast tissue, and that's called an extracapsular leak. Well, if you do MRI scans on patients and you find that they've got a leaking implant, about 75%, 3/4 of those patients will have an intracapsular leak, and about 1/4 will have an extracapsular leak. If you do a scan on the patients that have got the intracapsular leak a year later, you'll find that about 1 in 10 has progressed to being an extracapsular leak. So it's a slow process. It's the extracapsular leaks that need to be dealt with more urgently, because once the gel of any implant gets outside and into the breast tissue, the body can react to it. It causes inflammation, and the body walls off tiny little pieces of silicone, forming lumps. And they can be in the lymph nodes under the arm, or they can be in the breast itself, typically. But that's a slow process as you go from an intracapsular leak to the extracapsular leak and the possibility of forming lumps. The lumps aren't dangerous, incidentally. They're a nuisance, but they won't harm you. They're nothing to do with cancer. So if you have a leaking implant, it's best to get it removed. If it's an intracapsular leak, there's no real urgency about it. It's fine to do that over a period of months or perhaps even up to a year. If you have an extracapsular leak, you should probably get on with it a bit sooner, over a matter of certainly no more than months.